Hi, in this video, I'm going to be talking about breast size, the risk of breast cancer, and how it plays a role in treatment decisions. So it is natural to think that the larger somebody's breast is, the more breast tissue, the more likely they are to get breast cancer, but that's actually not the case. So one is not more likely to get breast cancer if one is larger breasted, nor is one protected from breast cancer if one has smaller breasts. It's really common to think that it would be, but it's not the case. It's also not the case that breast size is associated with outcome. So you are as likely to be cured of breast cancer if you have larger breasts as if you have smaller breasts. So breast size does not play a role in either the risk of developing breast cancer or the breast cancer prognosis, meaning the likelihood of the disease coming back in the breast or elsewhere. When we talk about breast characteristics and the risk of breast cancer, breast density is associated with the risk of breast cancer. So people with more breast density, which is not breast size, have a higher likelihood of getting breast cancer. It's not much higher, but it's such that we do recommend that the people doing your breast imaging, your mammogram in particular, be aware when they schedule the mammogram that you have dense breasts. And in fact, there's a requirement now in the United States that if you are found to have dense breasts, that the mammography site where you get your mammogram inform you that mammography may miss some smaller lesions, smaller tumors in people with dense breasts. What that means is if, let's say you have a normal mammogram, but you notice an abnormality in the breast, not to say, oh, I just had a mammogram, everything's fine, but rather to go to your doctor. And actually, I recommend this for everybody. Mammograms can miss cancer, and so if you notice an abnormality, it's not explained by a mammogram or soon after or around the time of your mammogram, that the mammogram is not truth with a capital T. It's just part of the story. Physical exam and mammography go together. We have another video about MRI that we'll link to below. So breast size doesn't play a role in the risk of getting breast cancer or in the prognosis. Breast density, more dense breasts associated with a slightly higher likelihood of getting breast cancer. Breast density does not impact your likelihood of being cured from breast cancer. So does breast size make a difference? Well, breast size does make a difference when we look at local regional treatment options. So when it comes to making a decision about surgery, you may find that the size of your breast factors into the decision or recommendations about surgery. That's particularly the case if the breast cancer itself is on the larger size relative to the breast size. So it's really the ratio of the tumor to the size of your breast that matters. Also important is the location of the lesion. So if you have a rather large tumor relative to the breast size, and it's on the top part of the breast, when that's removed, what that will do when the incision heals is it may pull the nipple upward. And similarly, if the cancer is on the lower half of the breast, below the nipple, it's sometimes the case that the nipple can be pointing downwards after surgery. And so it's not just the size, but also the location that matters in terms of what's the best surgery for you to get a good cosmetic outcome. That's what we use, the term we use to talk about the appearance of your breast is the cosmetic outcome. So if it matters to you, and it doesn't matter to everybody how their breast looks after surgery, it's important to know that where the tumor sits and the size of the tumor relative to the size of your breast will factor into how your breast looks after surgery. And when we give radiation therapy, that can cause the breast to be smaller. So if your breast is already small and you have removal of a tumor that's relatively large to the breast size, radiation therapy can make your breast appear even smaller. Now, this may not be a problem to you other than the impact it has on the symmetry of your breasts. So take a small breast, a larger tumor, the surgical defect leaves less breast tissue. Radiation causes the breast to get even smaller. When you compare that to the unaffected breast, you may have some asymmetry. That can be managed in a whole host of ways, whether it's surgery on the other side to get some symmetry for you, or you can wear a partial breast prosthesis to help balance out the two sides. For many of my patients, balance is as important as the actual size of their breast or overall appearance. It's the symmetry that matters to people. I've actually covered a lot in this video. I talked about breast size and breast density and the risk of breast cancer, as well as the outcome from breast cancer, and then the role that breast size plays in coming up with a surgical plan for you. I hope it's been helpful. If it has, click like and subscribe. Follow us on Instagram, and as always, you can drop a comment below sharing your experiences, or you can send us a question.